and hello to everybody in different parts of the world. I really welcome this assessment of the World Breastfeeding Trend Initiative. This initiative has a glorious history, and now really the fact that most countries in the world, more than half of the countries in the world, have been engaged in this process is really a testimony to its effectiveness. I would say that one of the important points that has been described in the assessment is the engagement of multiple actors, and particularly the engagement of government. We understand the challenges that this still has, and the need to even have that more, because clearly country and government ownership is going to be important for the success of policy change. But what we definitely have seen in this evaluation is that assessments help progress, and the more assessments are done, the more progress is done. I also would like to highlight the importance of granular assessment. The World Breastfeeding Trend Initiative has 10 policy areas. And, of course, we have seen that some policy areas in some countries have progressed more than others. And even there's been a backsliding in some of the areas. But what is important is the comprehensive impact. As it's been demonstrated in the past, the higher the score, the better the breastfeeding indicators, which is really the demonstration that we can't have progress unless all those 10 areas are advanced. Now, we are frustrated by the fact that the breastfeeding globally has only marginally increased. But it's already good news that it has increased, but it's marginally increased. And we have globally set targets to reach at least half of the children by the year 2025 with exclusive breastfeeding. So, as you said, Nupur, we're still far, 41 to 50. That's a long way to go. Collectively, certainly we can focus our action on a series of priorities. You're going to hear from David about the Breastfeeding Collective, which is really an important collaboration, and really the alliances are critical to achieve better progress. Now, the Breastfeeding Collective has developed a scorecard, and it identifies a series of action priorities, and let me highlight some of them. Certainly, an important one is better regulation of marketing breast milk substitutes and adherence to the Code of Marketing breast milk substitute and the subsequent resolution. We've just released jointly with IPFAN and UNICEF a report, 2020 report on the code. And this report says that there's 136 countries out of the total of 194 that have some regulatory approaches. So that's good, but it's not all the countries. So 1/3 of the countries doesn't have a regulatory approach. And we've just heard about the challenges that Australia, for example, has. But out of the 136 countries, only 25 really have full implementation of the code and 42 partial implementation. So it's also a quality issue. It's a quantity issue and a quality issue. We need to have more countries and also better regulations. What are the issues? What is not covered by these regulations? Well, the extent of the coverage of breast milk substitute marketing, it doesn't go up to 36 months. It only covers the first few months of life. Still, claims are allowed on breast milk substitute. Still, educational materials are allowed from industry. And there's a big issue of the incentives given to healthcare workers. There's still the issue of donations made to hospitals and the sponsorship of pediatric associations. So that's where an action is needed to improve the quality of those regulations. Second important area is around health systems. And we've all heard that baby-friendly hospital initiative seems to be going backwards. That's why collectively WHO, UNICEF, with many other actors have now promoted, with of course with the Secretariat of the Baby Friendly Hospital Initiative, have promoted a new era of baby friendly hospital, where really these elements of the 10 steps of to exclusive breastfeeding have to be mainstreamed in the quality of care of all hospitals and all healthcare centers. So that's really a challenge to make this as an integral part of our way to deliver healthcare and as part of the universal health coverage agenda. We have essential nutrition action, and of course, promotion, protection is breastfeeding is part of them. But we need to do more on breastfeeding counseling. So that's another area of expansion. Health workers need to be better trained to do that, and they need to provide better support to all mothers. We now have more experience. We have better guidance. We've issued this year some new guidance on that, but collectively we need to act on that, and we need to invest resources on that. Third area, maternity protection. And this is both in terms of paid family leave, but also in terms of workplace policies. I must say there's been quite a lot of engagement from the International Labour Organization on this, but and we've heard that some countries are making progress, but again, much more to invest. And perhaps the fourth area I would like to highlight is the need to have better community support programs to promote, protect and support breastfeeding. Now, how do we get more action to do this? This year we have seen with great concern the risk that the COVID pandemic can push us back with more promotion of products seen by the companies, with less efficient services, even with some guidance that suggests that mothers with the disease should be separated from their children. We're saying that this shouldn't happen, but there must be, of course, vigilance and action there. But at the same time, there are a number of political processes that perhaps we can build on to get more commitments from countries. One of them is the Decade of Action on Nutrition, where in the midterm of its implementation, we're looking at the work program again, and we're trying to get really more collaboration, more alliances, more commitments around promotion, protection, and support of breastfeeding. And connected to this is the Nutrition Summit, Nutrition for Growth, where really promotion, protection, and support of breastfeeding is one of the key areas, certainly a key area connected to the implementation of health system and universal health coverage. So a lot to do, but I really would like to thank the World Breastfeeding Trend Initiative. As you said, Arun, this is actually one of the recommendation of the Breastfeeding Collective. Having good monitoring of the policies is an important tool for advocacy and to keep us on track. Thank you very much.